Well, good afternoon, everyone. Thank you for taking the time to be here. I, along with County Commissioners Debbie Lieberman and Judy Dodge, I'm Dan Foley, Montgomery County Commissioner, and each of us is co-chairing a separate committee for our Human Services Strategic Planning this year. And those three areas that we're working on are today's topic of health and safety. We've already had two discussions, one around income stability and education and life skills, and then we have a discussion coming up on Thursday at the National Composite Center, which I think Tom will shed some light on. But these three areas, income stability, education, life skills, and health and safety, are going to be the focus of some subcommittees that community leaders are going to be working on this summer. Today we're focusing on health and safety. I want to say thanks to Greg Hopkins, who's the director of the Community Health Centers of Greater Dayton and a member of our Homeless Solutions Policy Board. Greg, please wave your hand. Greg is the co-chair of this subcommittee, and he and I are going to be tasked with really trying to help come up with some meaningful recommendations about how the county plays its critical role in health and safety around human services issues. So again, we began our series of panel discussions last Thursday, continued yesterday. We've heard lots of great information from those first two discussions. Today is going to be no different. We're going to provide you with some background information, describe the format today, and then get the panel discussion started. I did want to give just one kind of top-of-mind example about how all these issues interconnect. And I think whether you're talking about health or safety or income stability or education and life skills, one of the things that we're mindful of is that the reason that we're having these discussions with all the panelists and the panelists that we've had before is to really try to pick up themes. That not only the themes that exist just within health and safety, but the themes that kind of blend together, because that's really, at the end of this strategic planning process, we want to make sure that we can look back and we say that we really worked hard on those themes. And I know we're probably going to hear about this today with Sheriff Plummer and Andrea and Brian and everybody, both Brians.
Both Brians. Yeah.
Both Brians. But if you look at just this heroin crisis that we've had over the last couple of years, not only do you see a public safety aspect, a law enforcement aspect because of the rise in property crimes, but you see unfortunately a tragic loss of life. If we look at the folks who've been booked into the county jail, sometimes they get booked in and they're taking a lot of heroin, they detox, they come out and they take the same amount of heroin. And as the sheriff knows and as Brian knows, it leads to loss of life. And so we know that about 47% of the 389 deaths that have occurred from folks who've left the jail from last January to this March, 47% of those are overdoses. And all of the people on this panel have been working really hard on these kind of issues. And I know we're all thankful that they have taken their time to help us think of these themes and articulate them so that we can really put some strategies together this summer. So we're doing this in partnership with the United Way, and I just want to introduce my good friend Tom Maltzby from the United Way to kind of help carry on the day. Tom, thanks very much.
Thank you, Commissioner. Welcome, everyone, panelists, those of you who are in the audience, and everyone who's been very instrumental in making this process possible. We're almost at the end. We're getting really good feedback, really good results in terms of this process, and we really do appreciate your participation. I'm really excited about the opportunity for United Way and the Family and Children's First Council to work together on this partnership. It's a strategic partnership. We've aligned our thinking and our processes and our research to make sure we get the best outcomes. We began early last summer, and that culminated in the publishing of a community needs assessment, which I'm sure many of you are familiar with. If not, Tom will certainly be able to show you how to get it. The strategic planning process will continue through the fall in several phases that will include large meetings of our members, as well as a series of meetings of our three work groups. So we're not done. We continue to process. We want to get the best information. Some of the best information you're going to have is going to be coming from this panel, and Tom is going to explain to you that process in a moment. All of these meetings will foster a review and discussion of the results of these panel discussions, as well as looking at models that may work here, other best practices, and what other communities may be doing. You know, we want to get the best of the best when we roll our process out. And through all of this, we'll remain committed to integrating the three focus areas of education and life skills, income and stability, and health and safety. So the overall purpose of this strategic planning process is to emerge with a set of common priorities, early strategies and actions to increase community alignment as we guide service delivery approaches and improve results for individuals, families, and children through a more intentional collective impact process. So let me bring to you next Tom Kelly, Montgomery County.
Thank you. I'd like to add my welcome as well and add my thanks for the panelists for the information they're going to provide this afternoon. So as you've heard, we started this panel discussions on the basis of taking our needs assessment work and adding a context to it. The needs assessment was published in the summer of 2014. It is, in fact, a report which digests information. It looks at interviews that were done in the community, looks at a variety of statistics, an amount of data. It takes all that work and condenses it into a report, into a final product. What we really wanted to do was to add context to that work and make it more three-dimensional. We've invited panelists who have expertise in these areas, the areas that really rose to the top from the needs assessment. The 5 panels each explored different topic areas, and you can see the topic areas that we're discussing today: health, healthcare, crime, violence, drugs, and nutrition. So they are going to lend their expertise to a variety of questions that have been provided to them. As Tom mentioned, as we move through the entire strategic planning process that will take us through the fall of this year, we are really interested in being sure that we integrate how all 3 of our focus areas come together, whether it is education and life skills, income and stability, or health and safety. What we do truly understand is that each of those areas are interdependent. In order for one to succeed, all 3 need to succeed. If one of them fails, the other is likely to fail as well. So having said all that, I'd like to bring Jim Gross up. Jim is going to be our facilitator for the afternoon, and he will provide you with some more specific information on how the panel will actually operate. Thank you.
Thank you, Tom. Good afternoon, everyone. I'm really looking forward to this one. I mean, I've looked forward to all of them so far, but obviously I've got a special connection to this group and really looking forward to it. When you take a look at the issues, health, healthcare, crime, violence, drugs, and nutrition, those are all very compelling issues, and we're very fortunate to have such a top-notch group to serve as panelists today. And in fact, you know, these are all very, very busy people. And I really hope that we don't have chaos going on in the streets right now, since we have all of the experts and the leaders here with us inside today.
I have to leave here.
But we appreciate them taking time to join us. And the questions that they will be answering, I believe, are very relevant. They're very thought-provoking, and they cross many of the issues that are up on the screen. So over the next 2 hours, we are going to be going over 8 different questions. And not all of the panelists will be answering all 8 questions. However, all of the 7 panelists will be answering questions number 1 and then the last 2 questions. So in between, there will be questions that only certain panelists will be asked to respond to. Now, we've let them know in advance what those questions are. And some of our panelists have actually provided some slides that will be up on the screen that will help support their comments. Each of the panelists have been asked to limit their responses to 3 minutes per question. And to kind of help nudge them along, we have a clock that sits in front of them with numbers about this big. And it will simply count down, and they'll know when 3 minutes is up. We will not stop them mid-sentence, especially the two individuals at the end of the table who are law enforcement authorities, and I do not want to tell them what to do. We may nudge them a little bit to keep their comments to 3 minutes. If they happen to run over a little bit, we will, in a very courteous way, ask them to conclude, but we will not stop them mid-sentence. So timing is very important. Since timing is important, and since we've really jam-packed these next 2 hours with a lot of questions for the 7 panelists, there will not be enough time for them to banter back and forth, and there will not be enough time for them to respond to any questions that you may have. However, we really encourage you to write your questions or comments down on the 3x5 cards that's been given to you. And at the end of the session, we would like for you to return the cards to us. There will be folks in the back of the room that will collect those cards. And your questions and comments then will be included in the process as the process moves forward. We may indeed have to go back to some of the panelists and get the answers to some of your questions. So we apologize for not being able to take time for your questions today, but we really want you to ask those questions, and we promise you that your input will be included in the process. Now, before I introduce the panelists, I would ask all of you in the audience to either please turn your phones off or put them on vibrate so we don't have interruptions. And if you do that, we would really appreciate it. So what I'd like to do now is to introduce the panelists. Starting with, to my left, is Brian Bucklew, who's the President and Chief Executive Officer of the Greater Dayton Area Hospital Association. Next to Brian is Sharon Coleman, who is the Executive Director of Abigail's Journey, which is a nonprofit organization here in town. It is a sincere pleasure to introduce Jeff Cooper, who is the Health Commissioner of Montgomery County. And next to Jeff is Andrea Hoff, who is the Director of Community Engagement and Special Initiatives with the Alcohol, Drug Addiction, and Mental Health Services Board of Montgomery County. Next to Andrea is Major Brian Johns of the Dayton Police Department. Next to Brian is Sheriff Phil Plummer of Montgomery County. And then last but not least is Sarah Payton, who wears a couple different hats. Not that everyone else on the panel doesn't wear more than one hat. But Sarah works part-time for Public Health Dayton Montgomery County as an epidemiologist and serves in other various roles. And then just recently, Sarah has been named the Director of the Master Public Health Program at Wright State's Boonshoff School of Medicine. So again, we thank all of you for taking time out of your day and joining us. And what I'd like to do now is get directly into question number 1. And for question number 1, we will simply go in order. Again, all panelists have been asked to respond to question number 1. And the question is up on the screen, but I will go ahead and read it for everyone. And question 1 is, what healthcare, crime, violence, drugs, nutrition strategies have the potential to provide the greatest impact across all 3 focus areas? Again, the 3 focus areas: education and life skills, health and safety, and income and stability. Brian?
Thank you. Thank the Montgomery County Commissioners for putting together these panel discussions. I think they're going to be very helpful for the community and as we kind of decide strategies moving forward. To answer this question, I think from the healthcare perspective, it's how do we incentivize people to make sure they can access the right care at the right time in the right facility for the right cost. Making sure that we have the most efficient and effective use of our healthcare resources in the community. To put a little bit of a context, we have a little bit of a bigger challenge than a lot of other communities in our country. If you take the top 100 metropolitan regions in our country, we're one of 10 that does not have any type of university, city, or county hospital. So that presents some challenges in our community and making sure that we provide the appropriate care and the necessary care in our community. The other key component is coordinated care, is making sure that we're coordinating care amongst not only just the acute level in the hospitals, but post-acute care and then chronic disease management. The greatest increase in our emergency departments have been treating for the symptoms of chronic disease which is the worst, I shouldn't say the worst, but the most inefficient, most expensive way to treat chronic disease. Making sure people have access to the right type of health care at the right time, working with community health centers of Greater Dayton, our FQHCs in the region, is making sure people have access to that type of appropriate care. To show you the amount of change that's gone on in healthcare, I'm starting my 10th year at the Hospital Association. Our strategic plan in 2012 was 75% different than what it was in 2005. Our strategic plan in 2015 is 75% different than what it was just 3 years ago. So hospitals are being held accountable for healthcare outcomes for individuals outside of the hospital walls. So when I started, the hospital's kind of main focus areas were the hospitals were the revenue centers. Now they're the cost centers in the healthcare system. If you go into one of our hospitals today, 74% of the patients in the hospital are either on Medicaid or Medicare. That's a challenging environment. And so trying to make sure people have access to the right care at the right time in the right facility for the right cost is the mantra that our hospitals have been utilizing and really focused in on community health and population health.
Thank you, Brian. Shallon?
Thank you. As I was sitting here listening to Brian, he gave some really powerful numbers. But one of the things that I really want to focus in on is the life skills and the income and stability. And one of the things that I'm finding in working in social services is that a lot of times people are stressed out more so through the intake process. They come with a lot of barriers, a lot of issues, and then they get stuck in that intake process where they're given things to do that are beyond their capability. And it even comes down to as small as transportation, not having money to get to where they need to get to in order to access the necessary services that they need. And so that's one of the issues that I'm finding that is preventing a lot of individuals from reaching out to those various services. In terms of the life skills, I think that we as providers, one of the things that I'm seeing is that we have, I'm not going to say we have to, but I would suggest that we start looking, instead of being case managers, along with that being mentors, showing and helping individuals how to access services in a way in which it's not going to cause them more issues and more stress. And so I think that that's something that we really need to take a look at, because like I said, I'm finding a lot of individuals coming with the little menial things that they can't access, you know. And so I believe that as we work in partnership and collaboration together, that we can provide those necessary little things that would allow them to go forward and move forward and become self-sufficient, and also to curtail some of the issues that we're confronted with, like drugs and crime, and which all of them are tied in together. So I think that that's something that I'm really focused in on, and I hope that we would take a look at those little things. It's not always the big things that causes people to be sideswiped. It's those little things. And so if we take a look at those and work on trying to prevent those, then a lot of times we'll be able to have a more successful rate in terms of providing the resources that individuals need.
Thank you, Shallon. Jeff?
Thank you, Mr. Gross. So when Public Health first looked at these questions, we decided to look at this from a big picture standpoint as opposed to addressing specific strategies for each of those focus areas. Our perspective at Public Health is that any selected strategy, regardless of the focus area, should incorporate the spectrum of prevention. I think you see that slide on the screen in front of you. It's a very effective framework being used nationally to coordinate comprehensive approaches to address complex public health problems. It's really about the combined application of the 6 levels on this framework that can be used to coordinate the efforts of different groups working on the same health issue. So it can be effective in addressing chronic disease prevention. It can be effective in addressing traditional public health programs such as infant mortality and communicable disease control. And it can be effective in addressing community health and safety issues on a widespread basis regarding violence and drug abuse. So if you go to the next slide then, regardless of the strategy or the intervention identified, it's really about then using the spectrum of prevention and understanding where that particular intervention falls on what we would call the health impact pyramid. So the health impact pyramid, and I won't read what you see on the slide in front of you, but it describes the impact of various public health interventions and the impact on overall population health improvement. So clearly, at the base of the pyramid, those two tiers at the base, those have greater population reach, and they ultimately have more measurable health outcomes long term. If we identify interventions moving up that pyramid, and we invest a significant amount of resources as a community in the top tiers, such as counseling and education and clinical interventions, those historically have more limited population reach, more limited public health impact because they're dependent on long-term individual behavior change, especially among adults, and that's very difficult to achieve. So in 30 seconds, the take-home message for us, in summary, is regardless of the strategy, incorporate the spectrum of prevention as a framework, and then invest in public health interventions that align with the base of the pyramid if we really are going to see long-term public health improvements.
Thank you, Jeff. Andrea?
Well, when I took a very similar approach that Jeff did and took this at a very kind of broad, sweeping focus. When we talk about creating healthy individuals across all three of those focus areas, and when I say healthy people, I'm talking both physically healthy but also mentally healthy, right? You're talking about individuals who do not commit crimes, don't use mind-altering substances, who care about and are bonded to their families and their community. They care about their education, being contributing members of society, and really kind of leaving this world a better place than if they weren't in it. When I think of that and what that entails, what I really think of is brain health. And I say that because everything, I'll say that one more time, everything we think, everything we feel, everything that we do begins in the brain, everything. And we know that brain development begins in utero and continues to develop up until about the age of 24. And even more current research is saying maybe even as long as into age 26. So those are formative years where we can do things that will help to create healthy human beings during those formative years, right? And all of that gets around this framework in the research that talks about risk and protective factors. So it's eliminating those things that put an individual at risk. It's promoting those things that are protective for them. And this research we've had for really decades now around substance abuse. So what puts an individual at risk for substance abuse, or what protects them from being at risk for substance abuse. The research is just now coming out around risk and protective factors around mental illness for us to be healthy mentally. In 2009, the Institute of Medicine came out with a seminal document that acknowledged for really the first time publicly that certain mental illnesses are preventable. And the book is called Preventing Mental, Emotional, Behavioral Disorders Among Youth. That was huge because prior to that, we did not acknowledge that. So in knowing that, these are the things that we really need to do, right? Acknowledging the risk and protective factors along the entire context of individuals to relationships to communities and to society, work in multiple facets. And then in the next one, we also see that there are certain risk and protective factors that have multiple applications. So we need to identify what those things are that can have a broad, sweeping impact on individuals and really put our efforts there.
Thank you, Andrea. Again, the question is regarding the strategies that have the potential to provide the greatest impact across all three focus areas. Now we're ready for the law enforcement perspective.
Well, I'm going to change it up a little bit and talk about law enforcement, not so much medical things, but I've been in law enforcement for 23 years. I've been a part of a lot of projects and strategies, and honestly, I've failed at quite a few of them. But some did, succeed. And what I have found is these two key factors and those things that have succeeded. First of all, they're being community-based, like our Serve Gun initiative. You have to have actually citizen participation in these programs to make them work. I can't I grew up in Old North Dayton. I can't go to West Dayton and tell them what to do or how to live or how to solve their problems. So I think it's very important that those folks actually live there and face those problems, have an active role in solving those problems. We can't solve them for them, but we're there to help them and whatever we can to get that done. And I think so far, from what I've seen, grassroots-wise, community-based is the way to go on solving some of those issues. And probably secondly, where I always mess up quite a bit is, I always call it being place-specific. And I kind of learned this the hard way through our opiate efforts here in East Dayton, where I grew up, and I actually oversee that place now. But we tried to reach out to those folks who are involved in prostitution, which is primarily, kind of takes place because of drug addiction and heroin addiction in East Dayton. And we try to have those folks come to a place they weren't comfortable with. And first time, 2 people showed up. And after some more talking to folks and learning from them, the folks actually had the problem, I learned that we must take our services to them. We can't wait for them to come to us, especially on something as dire as prostitution, HIV, and drug use, especially heroin use, where one use can actually take your life. So we actually took our program to them on the streets and began having that in local areas, local churches that offer services for opiate addicts and things like that. And to this day, our numbers and our turnout is so much more better than it was early on. My 2 points are, be it community-based. I think that's key and very important, and so is actually going to where they're at. If we have young men dying in West Dayton because of gun violence, that's where we should go and take our message. If we have women and folks dying of opioid overdoses in East Dayton, that's where we should go. And that's all I have in less than 3 minutes.
Thank you, Major Johns. Sheriff Plummer?
That was very good, Brian. I get 30 seconds of your time, I guess.
You can have it.
One thing I'm seeing what we're doing well in this community is collaborating and working together. It's easy to arrest people, and we've learned we can't arrest ourselves out of this problem. So we're all working together to help improve things. We're working on, prevention, education, and enforcement to help solve this heroin problem we have. We're working with the Adams Board. We have 2 drug coalitions, to help with prevention and education. And we're working with all the law enforcement agencies for enforcement. We have the Range Bulk Task Force, 17 agencies working together to combat this heroin problem. That's sharing a lot of data. That's going after the right people. We have the Bulk Currency Task Force, where we're looking at the Mexican drug cartels that are bringing the heroin to us. We're working those groups specific, and we've taken $2.5 million from them in the past year of our dollars that would have went back to Mexico. So we're working harder and smarter. We're working with the FBI and the DEA. We just started a new initiative, the Heroin-Involved Death Investigation Team. So anytime we have an overdose death, we have an investigative team, which is comprised of Dayton Police Department, the Sheriff's Office, the DEA, and the FBI, and we're going to go out and investigate every drug overdose, and we're going to hold the dealer accountable. I mean, that's one thing we have to do in this community is hold the dealers accountable. I have some sympathy for the users because this heroin's bad stuff. It takes over everybody's brain, and we have sympathy for those folks. And we're going to get them some help. But the dealers will be held accountable. We had 26,000 inmates booked in our jail last year. We've started a linkage project with the help of Adamus and the Human Service Levy. The linkages program it's an outreach program. We're trying to get people, mental health treatment, substance abuse treatment, find people jobs. We found 109 people jobs already that were in our jail. So initiatives like that where we all sit down at the table and say, hey, we've got these problems to solve. Let's work together because everybody at this table has suffered from dwindling resources in the past few years. Everybody in this room suffered from dwindling resources. So we're working smarter and harder, but I'm seeing a lot of positive movement in this community.
Thank you, Sheriff Plummer. Dr. Payton.
Okay, I'll just give you a little background on me because I come from a bit different perspective than some of the others. I'm an epidemiologist, and for those of you who don't know what that means, I'm a data geek. So I like to present data when I'm talking, and you're going to see that when you hear me talk. And I'm also I'm in academia, so I like theories and models, so I use those to talk about my points as well. So when I saw this question, I was like, well, how do we integrate all these different areas that we've been talking about on these 3 focus areas that we have for this strategic planning? My initial thoughts is how can we not integrate all of this together? Because I have up here, I have the social determinants of health. And those social determinants of health, that is the conditions in the environment in which we learn, in which we play, in which we grow in our community. And those are all those things we've been talking about in all these panels. That's income, that's our poverty issues, that's our access to care, that's our crime. All of these things are playing into our health. And to truly have a healthy community, we have to back it up. And the health agencies are going to have to kind of step out of their comfort zone because we're used to treating diseases, we're used to giving vaccines, and that's not all we need to do to make this a healthy community. We have to get those root causes that are out there in the community and that we know about and we've all been talking about. And it's not easy. We have a big task set ahead of us. But in the long term, it is going to be worth it. The next slide. So this is one of my models slides that I like to show. This one in particular is from the CDC, not just the CDC, but Healthy People 2020, the World Health Organization, all the major health institutions are talking about these social determinants of health and that we have to address these to truly have the healthy community that we need and we all deserve to have in Montgomery County. And you can see here, if we want our community to flourish, to be a healthy tree, we've got to attack our systems, we've got to attack the community assets, and we've got to address all these social determinants of health. We've got to address poverty, we have to address education, and we still have to be doing the great health care that we need to have as well. That's what I've got.
Thank you, Dr. Payton. Nice job. We got through question number 1, right on time, actually. Congratulations. Question number 2 will be answered by actually the first 4 panelists to my left, and we will start with Brian. Question number 2 is, what are the most effective integrated prevention and treatment strategies for physical health, mental health, and substance use? Brian?
Well, I think the most important thing is to figure out how to align the incentives. Right now, the way individuals, healthcare providers, whether they're doctors, hospitals, they are paid to do something. So nobody is incentivized to keep somebody out of the healthcare system from a financial standpoint. So they are incentivized to do a diagnosis, to do a treatment, to provide a service. And we need to figure out a different way to do that. Hospitals are being mandated to find out ways to do that because they're going to be paid on health outcomes, based on health outcomes. And so it is very much of a different shift than what has happened in the past. The other thing I think is making sure that we have individuals across the care continuum, so both pre-acute care, acute care, post-acute care, is making sure how do we get people the same information at the same time in the same context. And part of that is understanding the available resources in the community and having that in real time. So the number of beds that we have in the community, whether they're mental and behavioral health beds, whether they're detox beds, whether they're psychiatric intensive care beds, understanding what those assets are so we can utilize those assets in the most efficient, effective way. And we have the technology to do that. The biggest challenge in our community, I think, is in the mental behavioral health area. So if you look at the uncompensated care in Montgomery County, the net uncompensated care costs, so the costs to just the hospitals in Montgomery County, is over $250 million a year. It's $258 million a year. 65% of that is mental behavioral health services in the community. And so that is the biggest challenge that we have, I think, from a healthcare perspective, is making sure, how do we get people the right care at the right time in the right facility? And that's been a big challenge in the mental behavioral health situation. And a lot of that came to light with the closure of Twin Valley. I'm not going to blame this on Twin Valley. I think it just exposed the challenges that we've had in the community, and not just our community, but all communities. So I think that's one of the key areas that we really need to focus in on. And then making sure that the incentives are aligned. And that's going to be a daunting task. It's a daunting task for the hospitals, because in the past, if I went into the hospital and got treated and then didn't follow the discharge instructions and got treated again, the hospitals got paid twice. Well, now, under the current scenario, I'll get treated. If I don't follow the discharge instructions and I get readmitted within 30 days, the hospital's not going to get paid at all for that second visit and only get paid about 75% for that first visit. So they're trying to figure out, for the first time, the healthcare industry is being held accountable for people's healthcare options, healthcare outside of the facility itself.
Thank you, Brian. Shalyn?
Thank you. I'm going to kind of share from a personal perspective, and this is a very serious topic for me as a person that is in recovery as we speak. And one of the things that I understand from a personal perspective is that if you ask the person that is addicted, that is on drugs, to give that up and not give them something solid to replace that, because along with the drug use comes other activities, like being out there stealing and being out there doing all kind of things that normal people don't think about doing. And so you have to replace that with something. And I also understand is that we, and I think Brian alluded to it, we have to get serious about the recovery process. And there's no one entity that can do it all. We need to have a relationship with the police department. We need to have a relationship with employers. We need to have relationships with the mental health agencies, because these are the things that's going to help these people, persons, to become entertain a holistic approach. You know, I mean, it's just easy to say we want to help them to overcome their drug use, but then what happens after that? We need to be able to have in place a plan for individuals that's coming out of addiction, that's coming out the street, and give them something solid and stop rushing people through based on numbers. And they go right back out to the street to do the same thing they were doing before they came into your agency. So I think that this is going to take a really serious collaborative with the agencies that are doing the good work, like I said, the mental health, the police department, to really begin to say, you know, this is a serious matter and we're going to get serious about coming up with a solution, and allow these people that are really serious about recovery to have something that they can look forward to and not just a whole lot of promises.
Thank you, Shalyn. Public health perspective?
Well, this is probably the most difficult question for the panelists, I believe, to answer, especially for public health, because historically, public health has been about prevention, promotion, and protecting the environment. And it's very clear now that the national direction is to better integrate primary care, behavioral health care, and public health prevention. So this is the topic of discussion at the state level and at every local health department in the state of Ohio. I just came today from a public health combined conference in Columbus, and it's amazing. This conversation is occurring at the large urban health departments, and it's occurring in the small rural health departments as well. It's very clear that individuals with mental health disorders and substance abuse disorders have lower life expectancies than the general population. So how do we get them into treatment, address preventable chronic diseases? You can see from the slide, almost 70% of adults with a mental illness have some sort of chronic health condition. 1 in 5 adults with a mental illness has a substance abuse disorder. And those are aggravated by poor lifestyle choices. And as Dr. Payton indicated, long-term, the best strategies are those strategies that impact the social determinants of health and focusing on those socioeconomic factors, those environments such as the physical environment, the social environment, and the economic environment. So, the next slide, please. So it's always easier to conceptually put spheres on a slide and indicate the concept of what a solution should be. It's a lot more difficult then to actually identify and select the model, build the infrastructure, integrate and evaluate, implement the program, and then show sustainability long term. However, we can learn from other communities, and it's just a matter of doing that research. Specifically, the Substance Abuse Mental Health Services Administration, in conjunction with the Health Resources Services Administration's Center for Integrated Health Solutions, has a primary and behavioral healthcare integration program. It's currently funding 70 programs nationally, 4 in the state of Ohio. And it has shown to be effective for those funded programs in terms of improving access to primary care, improving prevention, early diagnosis and early identification, intervention, as well as overall health improvement for clients. So for us, the summary is learn from what's out there, what other communities are doing, and look at these best practice models.
Thanks, Jeff. Andrea?
Well, I think my response is actually going to make Brian's challenge of uncompensated care for behavioral health services even more challenging. And that's the very simple answer, that we need to stop thinking of mental illness and substance use disorders as separate from our physical health, right? Because I don't know that anyone would argue the fact that our brains are a part of our physical bodies, right? And despite the fact that mental illnesses and substance use disorders create behaviors that are challenging, it still has a physical cause. And when our brains are not functioning properly and doing its job as far as regulating the way we think and the way we feel and the way we behave, an individual has illness, right? And so we need to stop thinking of them as two different realms. And truly, a better term for mental health, the term mental health, is the term brain health. And we've seen the field starting to go in that direction. As a great example of what used to be called the Greater Dayton Mental Health Foundation is now the Greater Dayton Brain Health Foundation, so that people can really start to acknowledge what we know is in the research. And as you see how the World Health Organization has defined it, as that state of complete physical, mental, and social well-being, that there is no health without mental health. And what that really means currently is to start at the very beginning, is really an overhaul of the educational system that happens for healthcare providers. So physicians and nurses and other folks that are trained to treat the physical symptoms, but truly right now are receiving minimum education around mental health issues, around substance use disorders, and would tell you that they don't feel comfortable or even confident in their abilities to help individuals who are experiencing some mental health challenges. And so what really could happen is, starting with our primary care doctors, as we go into our visits, there are routine things that happen with our visits, right? We get our temperature taken, we get our blood pressure taken, and if something is awry with one of those things, then they help us. Imagine if they also asked you about depression, anxiety, or substance use, and helped you with those things as a routine part of your visit. The federal government, through the Substance Abuse Mental Health Service Administration, has come up with a model for that called SBIRT, where you receive a very brief screen, 3 to 5 questions. If you screen low to moderate risk, you receive a brief intervention, which is literally 10 to 15 minutes to educate you on some of the risks. And if you have a severe condition, they refer you to treatment. Imagine the impact that would have if that happened in every primary care facility, every pediatrician, every community-based clinic, every FQHC, the early detection, the early intervention that would be possible, and the help that we would be able to give people.
Thank you, Andrea. Before we move on to more law enforcement type questions, we have one more health, okay? Hang in there. We're about
I
ready
will.
to cut you loose.
I'm hanging in
I can tell you're chomping at the bit there, Major. Question number 3, again, is health-related, and there will be 3 responders, and in this order. It will be Jeff, Dr. Payton, and Brian Bucklew. So number 3 reads, there are clearly disproportionate health outcomes in our community based on economic status or race. What are the most effective health care and community responses? Mr. Commissioner.
Thank you, Mr. Former Commissioner. So it's very clear, as Jim indicated, that there are disparities in health outcomes and in health inequities occurring without Montgomery County. Everyone probably has a copy of the most recent public health community health assessment from 2014. As you see on the slide in front of you, the environments in which people live, work, learn, and play have a tremendous impact on their overall health. And as we focus in on this slide, it becomes very apparent that those, as Dr. Payton indicated, social determinants of health, so the physical environment, the social environment, and the economic environment, really impact the health and health equity among individuals living in low-income and or minority communities. So the national direction is to adopt what would be called a health in all policies approach to addressing health disparities. That basically means incorporating health and equity considerations into all decision-making across sectors. So regardless of whether it's the transportation sector, the housing sector, the education sector, it's about conducting health impact assessments to determine how those directions and strategies are going to impact overall population health and specifically the health of target communities. Well, we recognize that social determinants of health are the key drivers of health outcomes and health inequity. But how do we frame this and how do we start? We can't just tackle every single strategy initially for income and stability, education and life skills, and health and safety. So if you go on to the next slide, as a proposed starting point, you see the slide in front of you that lists the locations of our hospitals, our hospital systems in Montgomery County, our federally qualified health centers, as well as our free clinic reach out. If you go to the next slide, an option for us is to start by better aligning what we're doing with the Adamus Board, public health, hospitals, federally qualified health centers, and reach out. Specifically, hospitals have a requirement to do a community health needs assessment and then develop improvement strategies on a 3-year cycle. Public health, through accreditation, has a requirement to do that same type of planning on a 5-year cycle. Moving forward, it's imperative that we try to align those respective cycles because then we achieve what's on the right side of this slide. Better health outcomes, and you can see what happens as a result of that. We have shared ownership, we have shared metrics and performance measures, and it's ultimately about pooling and sharing of data. So in summary, use a health in all policies approach to addressing these issues and start as a proposal aligning community health improvement planning among our Adamus Board, public health, and our healthcare sectors.
Thanks, Jeff. Dr. Payton?
Okay, just a warning, I spent about an hour on this slide in my class, so everybody get comfortable. This is a model, this is the academic in me, and this is called the life course perspective. And this is something that Michael Liu published. Michael Liu's the head of HRSA right now, and I saw him present this about 10 years ago, and he did a fabulous job. And what this does is this looks at health disparities, and it's actually pretty simple, but it was an aha moment for me when I saw it, while I saw him present it. And this particular model is looking at birth outcomes, so infant mortality, for example. But what you can see here is that we have disparities in our population, and those disparities, they don't start when, for example, in this one, they don't start when the woman gets pregnant. They start back when she was a young girl, when the woman was a little girl, when she was a fetus inside of her mother. And we have all of these risk factors that are pushing certain populations down, as well as we have these protective factors that are pushing people up. And these risk factors are all these social determinants of health, or these no access to care, and all of these things that we've been talking about in these panels. And what we need to do as a society is take away some of those risk factors in these populations and increase those protective factors, the good nutrition, the good educations. What this also does is this is a place model. So this is representing not all places are equal, and we have to address, there are hot pockets, and if you go to the next slide, I'll talk about this a little more. This is a fresh off the press data map, so there's my second point data, that our epidemiologists at Public Health just finished this past week, and this is what we call an opportunity map. So what we did is we met with some people at FCFC, and we talked about what are all the indicators that we need for these 3 focus areas that we've been talking about, the health and safety, the education, the poverty, and all those, there's a variety of indicators, I don't have enough time to go through them all, have been placed into this map, and you can see that there are areas in Montgomery County where opportunity is much lower than others. So this white area on the map, those are the people or the communities that have the lowest opportunity in their communities. And one approach that you can take to address this is these zonal approaches. Attack these areas with low opportunity with all of our resources to help all of these different focus areas that we have. And the next slide. There are community examples that have been very successful that have done this in their communities. The Harlem's Children's Zone has had amazing success in their community. They started with a 5-block area and went door to door and found out what people needed with regard to transportation and all these different issues. And just as an example of their outcomes, they've decreased their infant mortality from 30 per 1,000 live births to about 7. So infant mortality in Harlem is better than it is here in Montgomery County. And those are just some examples.
Thank you, Dr. Payton. Brian?